All right, good afternoon. My name is Nikki George. I'm the nurse navigator for the Joint Replacement Program here at West Bloomfield and Royal Oak Medical Campus. I work with three surgeons, Dr. Trevor Banker, Dr. Jason Davis, and Dr. Rob Weir. My job today as your nurse is really to try and give you all the information you need to try and reduce your anxiety. There's nothing worse than going in for a procedure or a surgery and just not knowing who's who, what are they doing, what is this equipment, what is your role. So I'm going to walk you through the whole day of surgery. So hopefully you'll feel a little bit less anxious when you leave class today. That's my job. After me, the physical therapist, Suzette, will come and talk about any equipment that you might need, getting you home ready for after surgery. Okay, I'm sharing a slideshow with everybody at home as well as you guys. So I'm just going to go through the slides here. All right. Just like I said, we're just going to go through the day of surgery. We're also going to talk about home care, what to expect afterwards once we send you home, which we'll talk about. The most important thing is read the book that we gave you, the recovery guide book. Everybody have one at home? Do you have one at home? So we're going to Okay. So we'll take all the questions. Perfect. We're going to take all your questions at the end because I'm recording the class. But if anybody needs a book, let me know at the end of class and we'll make sure we get you that book. I can also send it by email. It is in PDF form. If that makes any sense to you. So I can send it to your house. I can send it to your family. It's pretty cool. I can also send you this recording if you miss me. I don't think you do. All right, let's talk about the telephone calls you're going to receive from Henry Ford Health. These are the two most important before surgery. The first call is from the PAT department. That's pre-anesthesia testing. Sometimes they call it pre-anesthesia screening. Either way, it's a registered nurse. They work with the anesthesia team. Their job is to call you about 5 to 10 days before surgery to go through all your current medications with you. It's not a long call, but it's an important call. So they will call you and they will go through your medications and they will tell you which ones to stop taking, keep taking, hold on the day of surgery, or take on the day of surgery. So I suggest if you take more than 2 medications on a daily basis, make the list now. You can even put it in your book, right? So when the nurse calls you and she's going through each medication with you, you can write on the right side, keep taking, stop taking on 2nd of October, whatever. Now, don't just include the medications a physician has given to you, prescribed to you. Include everything you take. I mean, all the way down to basic Tylenol, ibuprofen, lidocaine patches, Bengay cream, whatever you do, whether it's a vitamin, homeopathic medicines, anything, CBD oils, creams, gummies. Give them all the information because they then can say, oh yeah, that's fine. You can take that all the way up to the day of surgery. But there are some homeopathic medicines you can't. You have to stop taking a certain amount of time before surgery. So just give them all the information. It's a real pretty in-depth call, but it's not that long. If there's something missing, like if there's something from your clearance missing, let's say you forgot to get your blood drawn, they're going to say, Nikki, go and get your blood drawn. There's something missing here. Or, oh, hey, how come you don't have an x-ray of your hip? That would be strange, but get the x-ray done. So if there's something missing, they'll let you know. Now, the second call is probably the most exciting one, for sure it is. It's the scheduling one. They call you the day before surgery to give you your arrival time. Okay, now if your surgery is on a Monday, they'll call you the previous Friday. The reason why we don't give you your surgical time is because you can get confused. We don't want you making a mistake. So we're going to give you your arrival time. Your arrival time is when we want you to arrive at the hospital or the medical center. So if they say, Nikki, I'd like you to arrive on Monday morning at 5 a.m., that's what time I'm going to be here, 5 a.m. I'll get a great parking spot. Well, maybe not, depends. Now, if you're arriving at 5 a.m., you are the first surgery, right? We start around 6:45. a.m., 7 a.m. So please arrive when they ask you to arrive. Please just bring 2 people. We don't need your whole clan, okay? Just 2 people. If people want to be involved in your care, I love it, but keep them involved at home, right? Say, look, I don't need you on the day of surgery, but I might need you to pop and see me when my husband goes to work tomorrow, the next day. So line them up. If people want to help, let them help, right? You don't need a babysitter, just so you know, for this type of surgery. You do need a cheerleader, right? You need someone to give you a bit of a, yeah, you're doing great. Because not every day you're going to feel like that, that's for sure, right? You don't need a babysitter. If you live at home, you're independent, you're doing great, you will be fine on your own when you go home. But it is nice to have someone there the first night. They say that when you have a colonoscopy, there's someone spending the night with you, right? It's because you're having anesthesia. You want to make sure you're safe, all right? So that's the arrival time. Now, when they call you with your arrival time, they'll give you some extra information about when to stop eating and drinking. Make notes, okay? If in doubt, don't do it. That's what I always say. People get confused. Oh, they said I could drink clear liquids up until this time. Just do what they tell you to do. You have pills to take the morning of surgery, take them with some water. What's a clear liquid? Water, right? Maybe, hot tea. I don't know. They do a clear, like apple juice, grape juice, whatever, right? Now, if you have my chart, which I love, right now that I know how to use it, it actually gives you all of this information in my chart. If you go to the menu, which is the 3 horizontal lines, if you click on menu, a whole list populates, and you're going to look for letters. If you go down to letters, you're going to see your whole conversation that you had with the nurse on the telephone about your medications, and it will all be listed very clearly about which ones to stop taking and when. I like that, right? And then if you keep scrolling down below that, it will give you information about eating and drinking, right? So, if you have my chart, great. If not, you can always ask the nurse when they call you to go through your medicines with you, can you mail that to me? Can you mail that to me? They'll mail it to you in paper form, okay? If that's what you want. It's not a problem. Okay. Second part of the homework. So first part of your homework is please read the book. We made it for a reason, for you to read. Read it 2 or 3 times. Make notes in it. Write in it. It's your book. Share it with your friends, your support people, people that are around you, okay? Second part of the homework, showering instructions. We just want you to take 2 antibacterial showers before you have surgery, okay? Hopefully you've received these little sponges. This is the antibacterial soap we want you to use. If not, we will give them to you today if you're here in person, or we can mail them to you as well. Let us know at the end. What we want you to do, now you can either take your first shower the night before, second shower the morning of, right? You can do that. Or you can do it 2 nights before, the night before, morning of, put clean clothes on, come to the hospital. It's up to you, right? I had surgery here, different surgery, same protocol. I chose to have my first shower Saturday night, my second shower Sunday night, Monday morning. I had my clothes laid out, put my clothes on, came to the hospital because I know I had to clean myself again. So I had inside information, right? And I didn't want to get up at 3 a.m. and have a shower, just to be honest. So it doesn't matter when you do them, as long as you do them, right? Because when you're in the pre-op area and the nurse is chatting with you, she's going to say, did you take your 2 showers? And your answer is yes. She's not going to say when and where were you, right? They just want to make sure you've done them, right? Why are we getting you to do this? To reduce the chance of any infections, right? So the soap is already in the sponge. We just want you to go in the shower, have a regular shower like you always do, rinse your own soap off. Once all of your soap is off, right? I would turn the water off. I've turned the water off. It's easier. Open this up. Soap's already in there. Your body's already wet. You're going to scrub your whole body from your neck to your toes what are you going to concentrate on? Your hip or knee, wherever you're having surgery, right? So if it's your hip, scrub it for a good couple of minutes. This does not go on your face or your private parts, okay? But concentrate on your hip or knee, okay? Once you're done, turn the water on, rinse it off. You will see a little blue finger pick in here. It's a little plastic finger pick to clean under your nails with. It's amazing what you can find underneath your nails. You think you have clean nails? Use that. You don't, right? So once you've rinsed all the antibacterial soap off, please use a clean towel. That makes sense, doesn't it? Sleep in clean pajamas and fresh sheets, right? A lot of research out there. The more we clean ourselves, the less chance of infection, of course, right? We'll do what it takes. Someone tells me to do it, I'll do it, right? Second shower, same thing, second sponge. Don't overthink it. Please don't overthink it. It's in the book, tells you what to do. We just want you to take 2 showers, okay? All right. What to bring with you to the hospital? Not a suitcase. You're not moving in, right? That's the olden days, all right? This type of surgery now is outpatient. That means that most patients go home day of surgery if they pass their physical therapy goals. Most patients do, okay? If someone had to spend the night, it's rarely because of physical therapy. It's mostly because of a medical reason. Maybe their blood pressure is very high or they're feeling nauseous. It's quite rare though with the anesthesia you have. So, and it's quite rare that patients stay overnight. It's not like it used to be. A lot of things have changed, but they're all for the better for you. Safest place is home. Okay. So what I would bring with you though, most important things to bring with you on the day of surgery are glasses if you use them to read, hearing aids if you use them to hear better, dentures if you use them to chew food, and maybe your cell phone, you know, things like that. But your family will have to hold on to your cell phone when you're in surgery. Anything valuable, don't wear jewelry. Take all your jewelry off, okay? No bobby pins, no metal, right? Change of clothes. I think it's always a good idea to take a change of clothes just in case you need them, right? Maybe you spill coffee on your shorts or something. But the clothes that you wear here are the clothes you go home in. You're only wearing them for 20 minutes, right? Or whatever. But that's the most important thing. If you have a CPAP machine, please bring it into the hospital. If you don't know what that is, you do not have a CPAP. I guarantee you would know, right? If you have your medication list that you take on a daily basis, if you want to print it off and bring it in, feel free to do so because the nurse will go through that again with you in the pre-op area. I recommend that you bring your recovery guide book in with you because you have all the stuff in the back leaflet in the little folder at the back, and you know we're going to give you more paperwork, right? So just bring your book in. Then we can put everything in one spot and everything will be in there. Okay, so it's a good idea. All right, so I would say that's the most important thing. You don't really need to bring your insurance card and your ID, but if you want to, you can. I'm the kind of person that if they say not to, I'll bring it because I know if I don't bring it, someone's going to ask me for it. It's just the law of whatever. Okay. All right, day of surgery, you arrive at the main entrance at West Bloomfield or Royal Oak. At West Bloomfield, you go up to the 2nd floor surgery lounge where you'll check in at the desk. At Royal Oak, you're going to go to the 5th floor. Everything is signposted very well. Okay, if you come in and you're not sure where to go, someone will show you. Okay, you'll check in at the check-in desk, and then a nurse or a perioperative assistant will come to collect the patient. Okay. If you want to bring your insurance card, you can. Surgery takes a couple of hours. All right, about 2 hours, and you'll be discharged from the recovery area, which is a very similar area that you come into. So you'll be very familiar with the staff. Okay, you'll recognize it. All right. Your care team, we already went through the surgeons, Dr. Banker, Dr. Davis, Dr. Weir. It's not just them. They have a whole team supporting them on the day of surgery. You're going to see a lot of people. I followed patients through the whole pathway. a long time ago, but I watched each surgeon do surgery. I went through with the patients, and it gave me a really good idea of the day of. When you follow someone the whole way through, it gives you a really clear picture of their whole day, right? So when you're in the pre-op area, you're going to see a lot of providers. They're all going to look the same because they wear the same color scrubs. Green, not the blue that I'm wearing, but the green, and they get them from a little bin in the operating room. But everybody's going to have a badge, all right? So that's my badge, RN. You're going to see the surgeon. They're going to come and talk to you. They're going to say, hey, what am I doing for you today? And you're going to tell them, what are they doing for you today? You're going to replace my left knee. And they're going to say, okay, if I mark my initials with this skin marker on your left knee, yes, you may, right? So they'll put their initials on your knee. The physician assistant, the PA, who you may have met already in the clinic, there are many, all right? Let me see. Adriana, Angelo, Angela, Dominic, Christopher, Mark, Shauna. I mean, I think I didn't leave anyone out, but you'll see one of them, and they'll mark your knee or hip as well with a purple marker, ask you a couple of questions. Okay, so that's the surgeon, the PA, the anesthesiologist. They're going to come and talk to you about how they're going to put you to sleep, ask you some questions. Your nurse, RN, they'll be asking you questions that you've already been asked. Some of them are very, not funny, but just questions you might not have been asked before. Like, has anyone ever told you that you snore at night? Right? Do you feel safe at home? That's a serious question. Do you feel safe at home? When did you last eat or drink anything? So these questions you may have been asked, but they're very important questions. Okay, so that's your nurse. The POA, perioperative assistant, is like a nursing assistant. They're very helpful. You'll meet them in the pre-op area. They help you get all settled, and if you need help wiping down, they'll help wipe you down. Very helpful. Physical therapist, you'll see Suzette after me. They wear dark navy blue scrubs, and it says PT on their badge, physical therapist. And then I'm the nurse navigator, and there's just one. It's probably a good thing, right? So we take you to the pre-op area. Just the patient goes back for about 40 minutes. Then your family can come back and sit with you all the way until you go through for surgery. But you will not be lonely. You got lots of friends coming to see you, right? It's like Grand Central Station. Right? People come in, people go out, people come in. I always try to go in between people. Like if a surgeon goes in and then nobody's there, I'll try and pop in and say hello. All right. Now, the first thing we do when we take you back to the pre-op area is we take you to a weighing scale to get an accurate weight of the day. Okay. We also give you a little tub of mouthwash, and we ask you to go into the bathroom to swish and spit, right? Get rid of any bacteria that's in your mouth as well. Then they take you to a little stretcher that's all prepared just for you. Okay. We have these wipes. 3 packets will be on the stretcher. This is the same soap that you just cleaned your body with at home, but it's in a wipe form, like a baby wipe. So there's 2 wipes in each packet, so there's a total of 6, right? They come from an oven. We're not that cruel, right? We're quite nice, especially on Tuesdays. No, I'm kidding. So these wipes, you will be instructed to take your clothes off, put your clothes in a property bag, and wipe down your whole body from your neck to your toes, just like you did in the shower, avoiding your face and your private parts. And then at the end, the nurse or the POA will come and help do your back. They give you a diagram. If you don't know what a body looks like, you will when you come here for surgery. We have a little diagram of use this wipe on this arm, use this wipe on your torso, use this wipe on your leg. So we tell you how to do it. You basically wipe down your whole body, right? It feels a little tacky at first until it dries. It's only for a few seconds. I'm just telling you that from personal experience. As soon as you've wiped your whole body down, the last thing you're going to wipe is your feet, right? You're going to sit on the stretcher, wipe your feet, and then you're going to put your socks on, okay? And your magical gown. It opens at the back, okay? It opens at the back. All right, don't tie it at the back, okay? It opens at the back. So you're going to sit on the stretcher. And the nurse will say, are you ready for me to come in? And you'll say yes. While you're doing all this, by the way, and I can tell you, right, having had surgery here, different one, but same protocol, the nurse was asking me questions through the curtain. She's like, hey, Nikki, anyone ever told you that you snore in bed? No? Okay, she's just getting her stuff done, right? But when she comes in, you're sitting on the stretcher, you got your socks on, you got your gown on, okay? She'll just ask you a few more questions, right? And then they're going to start attaching little electrodes, just like when you have a colonoscopy. See these electrodes? There'll be 3 of them. One on the right side of your chest, one on the left, one underneath your rib cage. 3. Connected to a machine, just telling us your heart rate all the time, okay? Then she's going to start, she or he, are going to start an IV line in your left hand or right hand. Either one. So if you have a preference, if you think you have wonderful veins on one hand, let them know. I hear people saying all the time, this one's always lucky. Well, okay. So they'll start an IV line. So that gives you intravenous fluids, antibiotics, sleeping medicine. Okay. On the same hand as your IV, they're going to stick this little sticker on your ring finger. This monitors your oxygen levels. This is also attached to the monitor above your head to tell us what level your oxygen is. It's got a little light at the end. It's just like a little Band-Aid sticker. It's better to not wear nail polish, or if you have to have nail polish, have a very light shade of nail polish. I think Henry Ford Health are moving away from nail polish on your fingers anyway, just because of the oxygen probe. So that'll be on your little ring finger. On the opposite arm, you will have your blood pressure cuff that will be placed at the top, right? Obviously not on the same arm as your IV. We don't want to stop the fluids going in because this is going to be puffing up, getting tight. When it starts puffing up, you'll feel it, right? Just relax your arm on the bed and it takes it a lot faster and a lot less painful. You do this, you fight against it, it will keep going and going. So just relax your arm, okay? The last electrode goes on your forehead, right or left. I know it looks a bit strange, but this goes right here. This is connected to the monitor. You do feel like Pinocchio for a little bit, but this is just for during the surgery. After surgery, we take all this off. But this monitors your temperature very accurately, right? So we know in the operating room, if you're getting a little bit too cold, we know, so we can warm you up. Or if you're too warm, we can cool you down. It's just very clever, right? So you have all these things attached to you. The nurse will clean just inside your nose with this product called Nose-In. It's a nasal sanitizer, right? We just treat everybody, right? It's like a hand sanitizer, but for your nose. Yes, great. We used to do this. Well, we've done this for years, right? With joint patients. Guess what? Everyone does it now. After COVID, we sanitize everything. All right, the nurse will have these little ampules. You'll see them on your little bedside table. There's 3 of them. They got like a little yellow liquid in. What the nurse will do is she'll pop it, squeeze the liquid into the end, and just gently insert into the tip, right, of your nose, just like that. And they do this. They go both ways, and then they do the other nostril both ways, okay? It smells like orange oil if you've ever cleaned wood. You know, it's a citrusy, it's a nice smell. It's really quite nice. So they'll do it 3 of them. You're going to be cleaner than the day you were born. I guarantee you. The only negative thing about all this cleaning, it's good. The only negative thing is your skin can feel a little dry and itchy. Mine did. After the second shower, I was really wanting to put some body lotion on. Please don't do that. You can put face cream on, but please don't defeat the purpose, right? Don't put any lotions or talcum powder on once you've done this, all right? It will be, it just won't make sense. So that all takes about half an hour, 35 minutes. Then your family can come back and sit with you all the way until you go through for surgery. But like I said, you won't be lonely. Okay. That's what it looks like, the pre-op area and the post-op area. It's exactly the same. Now, before you go back to the operating room, I'm going to give you a little secret. Okay. 2 people come to collect you. The nurse from the operating room and the CRNA, that's a certified registered nurse anesthetist, okay? They're your buddy, right? They go in with you and they come out with you, right? So you probably remember them. Maybe they give you their names, but you might not. In their pocket, they have a little medication. I call it happy juice, but I would never say that, right? It's a little medication and they give you into your IV and you just feel relaxed. I mean, that's just it, but you don't remember anything, right? Causes amnesia. You don't remember. I didn't remember anything after they gave you that medicine until I woke up in the recovery area, asked the nurse when they were taking me, and she was like, "You've been here 2 hours." What? But the interesting thing is you don't remember anything, but you're very cooperative, right? So you go into the operating room. With this surgery, what we do is a short spinal. A short spinal is a one-time shot in your lower back, keeps you numb for just a couple of hours, not that long. That's purely pain control, right? Now, you may not remember any of it, or you may remember the first patient this morning said, "No, I don't remember. I remember hunching my back." He said, "Someone told me to hunch my back like an angry cat." So he did that. He said all he remembers is them cleaning his back with a cold solution. And that's it. Maybe that's all you'll remember, or you won't even. I didn't remember anything when I went in, right? So, but it's interesting how you go from remembering to not remembering and then waking up. And I'm very thankful for that, right? You will wake up in the recovery room. It may be the same spot that you left. You know, you wake up, you'll be like, "I saw you a minute ago." Nope, that was 2 hours ago, but yep. Pretty cool. The first thing we do when we receive you from the operating room is we get a portable x-ray of your knee or hip. So this little machine comes along and it takes an x-ray right there and then. You might remember that, you might not, right? Some people are, "Oh yeah, I remember them taking a picture." It's just a picture, right? X-ray of your knee or hip. Second thing is we sit you up, we give you ice chips and crackers. And then if you're good with that, we give you proper snacks and juice, right? We have sandwiches, we have yogurts, we have food. We know you're hungry. As soon as that x-ray is done, we let your family come back and sit with you because it's going to be some time, right? Remember, your legs are going to be numb. So we have to wait for your legs to wake up before you do physical therapy, right? So may as well bring your family back. You guys can chat about what you want to chat about, right? But yes, just don't forget it will be numb. The only patients that don't have to participate with physical therapy on the day of surgery are the partial knee replacement patients. They get a pass. They don't have to pass PT. They can just go home once they go to the bathroom to pee. Okay? Nobody does physical therapy until their legs have woken up. Okay, nobody can get up. You can't get up, right? You'll feel like little tingling sensation, little pins and needles, and then all of a sudden one toe will move. And you'll be like, "Oh," and then all of a sudden the other foot might move. It takes time. Sometimes it's real fast, and then sometimes it just takes its time. And if it takes its time, just have more snacks. That's what I tell people, right? Just have some more snacks, all right? As soon as it's worn off and you're ready for physical therapy, we send a text message to them and we say, "Nikki George is ready in room 8 for physical therapy." They bring their own walker. You do not need to bring your walker into the hospital or the medical center, which is great because we don't want your family carrying that around all day. Don't need to. They will bring a walker with them. You'll do your physical therapy with them. And please, it's not hard, right? You have to walk at least 50 feet, which you did to come in here probably. And you go up and down 3 or 4 steps. You can do 3 or 4 steps. You can do 14 steps because I get that question a lot. "Well, I live in a townhouse. I have 14 steps to get in." You can do 4 steps. You can do 14 steps. We just don't want you going up and down, up and down, up and down. And they'll tell you that on the day, of course, right? We just want you to go up, stay there. All right. Once you've passed your physical therapy goals, you'll be able to go home. You'll be discharged. All your medications will be delivered to you. At Royal Oak, the only difference is you just pop down on the way out, pick them up from the pharmacy, and you head out. At West Bloomfield, they bring them to you. Okay. Things attached to you. Extra things. When you wake up, you'll have both lower legs will have this little sleeve on. It'll be pumping up air just to prevent blood clots. These are compression devices, right? You've probably seen patients with them ever in hospital. right? You'll feel them getting tight. One will go up and then a few minutes later, the other one will go up, okay? We obviously put these in the trash. You'll have a bandage on your knee or hip and it looks like this. This is called Aquacel. This is the bandage that you have on your knee or hip. This bandage goes on your knee or hip and stays on for about a week. We send a registered nurse to your home to remove the bandage, okay? All right, the great thing about the bandage is it's shower proof. So you can shower the following day. Nobody needs to shower the day of surgery. You're very clean. Plus, you've had anesthesia, right? You might not feel up to getting into a hot shower, which might not be a good idea anyway. All right. A lot of people say, should I get a shower chair? You know, I'm having surgery. If you sit down in the shower now, of course, yes, definitely. But if you don't regularly sit down in the shower, there is no need to go and buy a shower chair. Okay. You don't have to, right? All right, so that's the bandage. You'll still have IV fluids going. The best thing to do is drink, drink, drink. So if they give you water, drink, drink, drink. All right. You may have a little bit of oxygen in your nose. We'll try and take this little hat off. As soon as you come back, we'll try and take this hat off. I know this is your surgical cap. Remember these? This used to be blue. It was like a blue net. Yeah, it's now silver to keep you warm. Yeah. Do you remember Jiffy Pop, the popcorn? As soon as I saw this, I was like, popcorn, my parents said, never make this unless we're home. And then we're like swiping the smoke out of the kitchen. All right. So you have a couple of things attached to you. Now the ice packs will be on your knee or your hip. As soon as we do the x-ray, we put your ice packs on. Please don't go out and buy ice packs. You don't need to. Okay, we give you ice packs and a wrap to take home with you. We get a lot of questions. Sometimes patients will say, well, my friend has a ice machine and they're going to lend it to me. This is a different surgery to what your friend probably had. That can be too cold. Also, you're attached to something which less likely you're going to get up every hour, which we want you to, right? If you're attached to a machine, you're not going to get up every hour, right? And it's very cold. You have a very thin bandage. So this is the ice wrap we'll send you home with. It has ice packs in each sleeve. So there's one here. And then another one in here. This is a hip wrap, just has the one strap. The knee wrap has two straps. So you can wrap it around your knee as snug as you want. White side to the skin. If you're very sensitive to cold and you don't want the cold, you could put a tea towel or a light towel in between your skin and the ice. But ice is going to be your best friend. All right, if it's not already. Now, a lot of people say, how often should I ice? Is it 20 on, 20 off? Look, there are so many different ways of icing, right? Just take it off. Every hour when you're getting up to walk for 10, 15 minutes, take it off, give your skin a break. You don't need to over ice, right? But ice is very helpful for swelling and pain, but you don't need to constantly keep it frozen. You just had a surgery, you have a fresh incision. Let your skin warm up naturally. Don't put heat on it. Just let it warm up naturally, right? If you know your physical therapist is coming to the house at 3 p.m., take your ice off it too. You know why? You want your knee to warm up and get ready for bending exercises. If they come and your ice is still on, what's this going to be? Right? Because it's so cold, right? Frozen. So give yourself a break. But the ice packs, we give you 4 of them because we want 2 of them here and 2 in your freezer. That way, in a few hours, when it's not cold anymore, you can throw these in the freezer and get the ones that are frozen, right? That's a great thing about these ice packs. And they're moldable. They mold to your skin, which is great. All right, so that's your ice. I like the ice packs. Pain. All right, this pain scale is the oldest one in history. I say that all the time. It's probably not the oldest one in history. In my history of nursing, it is. Wong-Baker scale. I learned this in 1991 in nursing school in England. This is great for children, maybe patients with dementia, but that's it. When someone says, what's your pain from 0 to 10? Is it easy using that scale? No, it's not. It's really not, okay? This is the best pain scale, this one. It's in the book now. You have it. It's a descriptive pain scale. I got it from a hospice nurse about 8 years ago. I think it's the best thing because it describes each pain. You know where you are if you read each number, right? Now, when you come out of surgery, what are you going to be? 0. Why? Because you're numb. You're numb. That's not going to last. It's going to start getting your attention. When it starts getting your attention, you say to the nurse, it's getting my attention. She'll say, what number is that? You'll say, about a 3, right? Okay, understand this, because when you go to a doctor, and I mean, share this with people too. Anyone in hospital, they obviously have some pain, right? When someone says to you, oh, what's your pain? It's like, oh, I don't know. It just hurts a lot. That's not helpful, right? But if you look at this and you see it, you'll understand, right? A few years ago, I had a severe back pain, went to a walk-in clinic. It was very, very painful. And they said to me, what's your pain from 0 to 10? Now, I saw the smiley face thing on her wall. I was like, but I know this pain scale to heart, right? I said 8. Now, initially, I don't think she believed me. You know that when you tell someone it's an 8 and they're like, is it though? Pain is what the patient says it is. Always, right? So if you're tearful, you just can't really perform certain tasks and you're struggling, it is an 8. So once they saw the shingles all over my back, they were like, oh yeah, that's probably an 8. Yeah, it's an 8, right? So just really try and understand your own body. Everybody's different, right? Don't compare yourself to anyone. You're going to hear stories. Oh, Bob down the road, he had his knee replaced. He was water skiing 3 days later. Okay, Bob, that's not true. And let's be realistic, right? Be sensible. We're relying on you to go home and manage your pain. Now, that doesn't mean go home and just see how you go. No, that means go home and schedule your medicine at least the first 3 to 5 days. That way, what do? Keep a lid on the pain. Because the first day you have surgery, you're going to feel great. You're going to be like, oh, I wish I'd done this 10 years ago. And then post-op day 3, after you've had the visit from the PT at home and you have swelling, it's not going to be a 2 or a 3. It might be a 4 or a 5. But if you're managing your medicines and you're making sure you have something every 4 to 6 hours and you're keeping a lid on it, you're going to be a lot more comfortable, right? And it's something you're not used to, right? Taking pain pills. Yes, but this is very temporary. This is very temporary, okay? All right, I can be the worst patient. Nurses are the worst, one of the worst, right? I had my gallbladder out, took my Tylenol, my ibuprofen. I did great until post-op day 2 when I had a severe pain in one of the incisions. And I was like, oh. And my husband said, what about the oxycodone they gave you, you told me to put in the safe? I'm never using that. I was like, get him, go and get him. Right, and I only used half. I actually used a pill cutter because I wasn't sure how I would be. And that half took away that pain completely. Took about half an hour though. So it does work. So please don't be afraid to take something to control your pain, because you're not going to be much fun to be around. I can tell you that. Manage your pain. Feel free to meditate, take deep breaths, watch Netflix, I don't know, listen to music, use your ice, elevate, do whatever it takes, right? Whatever it takes. We do give pain medication refills, of course, so if you're running low, please call and we will refill. We do not refill pain medicines over the weekend. They don't do it, so don't call. If you think you're going to run out on a Sunday, call Thursday or Friday. It can take 2 days to get a refill process through the whole thing, right? So be smart about it. Count the pills up, say, okay, I'm using 3 a day. Okay, so this is how many I have. Okay, let me make sure I have enough to get me through the weekend. That's the smart way to do it, all right? We'll do questions at the end though, just because I'm recording. Write it down. All right, after surgery, your numbness is gone, you're getting up with physical therapy. Remember the partial knees, they don't have to participate with therapy. They still have to go to the bathroom to urinate before they leave, but that's it. PT is 1-to-1. So you'll see your physical therapist 1-to-1. Your family will be there, they can follow you. Hip patients will see an occupational therapist as well. So they'll have a PT session and an OT session. And if everything goes well, you'll be off home. Your medications will be delivered to you. That walker on the screen, that's the walker we want you to have, right? 2 wheels on the front. It looks like they have tennis balls on the back. So if you have a lot of wood flooring, tile flooring, it's a good idea to put those little tennis balls on the back. It's a lot smoother and it doesn't ruin your floors. Okay, some people have skis on the back. Have you seen them? Little gliders, because they have like a lot of carpet. So it's a lot easier for them to, the little skis to go across the carpet. So it's up to you. You can do what you want. Preventing blood clots is obviously important with any surgery you have. Get up and move. Take some deep breaths, right? Drink lots of water. We will give you a medication to, try and prevent anything like that happening, but just keep moving. Motion is lotion. With this surgery, keep going. Even when you have a baby, they tell you to get up and walk the whole way, right? They're like, come on, get up. You're like, oh, what, right? But it's a very good idea to move. This is the most annoying thing about having surgery is constipation. It's, if you know, you know. Okay. We send you home with stool softeners. Okay, Seneca, it's called Seneca. You'll take it twice a day until we have regular bowel movements. Now, if you think you need something else, do it. Start your Miralax that night or drink your Smooth Move tea, right? That's a laxative tea. I use that after my surgery on post-op day 2. It's a good tea, it works, but it is a laxative tea. So don't keep it with your regular tea bags, okay? Put it in the medicine cabinet, treat it like a medicine. Prune juice, fresh prunes, whatever you use. Kiwi fruit's a great laxative. Don't know if you like kiwis, but they are delicious. All right, drink water, eat fresh fruits, fresh vegetables, have a good diet, help yourself, right? The problem with pain pills is constipation. It's annoying, but don't get constipated because it can be worse than the surgery. All right, so try and just be proactive if you can. Discharge instructions are provided to you when your family are at the bedside. It's called an after visit summary. Every time you go and see a doctor at Henry Ford, they give you papers and you put them in the back seat of the car and you're like, okay, these are important. Put these in the back of the book because these will be thicker because it will have really important information about, your home care visits, when to start your home medications, when you can next take a pain pill, any appointments that you have will all be in there. So, I mean, it will all be in my chart too, but if you don't have my chart, keep those papers safe, all right? So let's pretend you're having surgery this Friday. We send a team to your house the very next day, so that would be Saturday. You'll see a registered nurse and you'll see a physical therapist. They will both call you in the morning and they'll say, hi, it's Nikki from Henry Ford Home Care. I'm coming to see you today between 12 and 2. And then the therapist will come out the same day separately. When they come out, they'll give you a little calendar of when they're coming next, because the nurse comes 2 to 3 times over 2 weeks, and the therapist comes 5 to 6 times over 2 weeks. They spread out their visits. All right, so you have 2 weeks of home care. We arrange that for you. Now, if you're not going to your home, do you think it's a good idea you tell us? It sure is. If you're going to Mary's house in Drummond Island, we need to know, right? It's very important. And some people do. They stay at their sister's house because she has a ranch. She has no stairs. I don't want to deal with them. Fine. We need to know where you're going to be because we are arranging your home care visits. If you need to, just send me an email because I can keep in touch with the home care team. So let us know if it's a different address. All right. And it doesn't matter where you are in Michigan. You can live on Drummond Island. We can find a home care team for you. Right. It's not going to be Henry Ford, but it's going to be somebody like McLaren or someone. Right. We have people all around Michigan. So just let us know. After the 2 weeks of home care, we would like you to go to outpatient physical therapy, but this is on you. You have to arrange this yourself. So your visits with outpatient PT, we would like you to arrange. And if I was you, I would start arranging that maybe a week before your surgery. So if my surgery was next Tuesday, I would probably call this week and say, hey, I'm having surgery next Tuesday and I have my home care for 2 weeks. Can you guys schedule me in for my evaluation? Because the clinic secretaries, they actually put all the orders in the system, not for you. It's not a prescription. Don't think it is. It's not for you. They put it in the system for like Henry Ford to see, right? So you can call Columbus or here or wherever you are. Now, let's say you live somewhere that's nowhere near Henry Ford outpatient, right? Call the clinic. We can fax the order to the location wherever you're going to go. Like, let's say it's I don't know, I'm making that up now. ATI in Clarkston, Team Rehab in Ann Arbor, whatever it is. Just get the fax number, call the clinic, and say, hey, can you fax my prescription to this place? This is where I want to go. All right. So try and remember, try and get your outpatient PT set up maybe a week before your surgery. That way everything's like a smooth transition for you afterwards. You're going from home PT to outpatient PT. Okay. I give everybody a call a week before surgery just to check in with you. How's everything going? Any questions after the class? Did you pick up your walker? Have you arranged your outpatient PT visits yet? I'm kind of like your reminder fairy, right? And then most people do have questions. Now, I don't work in the clinic, so if it's a clearance question, don't call Nikki because she doesn't know, right? But you could always call the clinic and speak to one of the nurses like Jennifer or Michelle or Anne, okay? One thing we do want you to remember is after this type of surgery, you will probably get some swelling and bruising. Not on the day of surgery, everything's fabulous, right? Like between days 3 and 6, the swelling creeps in and the bruising starts, and it can look a little ugly, only for a little bit, right? Don't panic. Keep a diary of what time you're taking your pain pills too. There's a little spot in the book. I'm not sure what page it is, but it's there. You can write down what time you're taking your pain pills. When you're on pain pills, you forget what time you took them. So we don't want you taking too many, that's for sure. So write down what time. All right, this gentleman had a total knee, sent us these pictures and said, hey, Nikki, I'm doing great. My pain is only 3 out of 10. I'm not even taking strong pain pills, but my wife was concerned about the bruising and it was all the way from his butt cheek to his toe. Now, he overdid it, right? So mostly men between 50 and 65. He was about 57, I don't know, mid-50s. So just do what the physical therapist recommends and get up every hour of the day. That's all you need to do. You're not going to win a medal. There are no prizes. I know, right? His bruising was quite extensive, but look at his bandage. Clean, dry, intact, hardly any swelling, doing great. Pain not even above a 3, but he had a lot of bruising. So he had his other knee done a month later, and he had hardly any bruising. Why? Because he listened to his therapist. Period. Right? He did what he was supposed to do. He didn't overdo it. Didn't go to the gym. He just did what he was supposed to do. All right? Don't be Brian. Blisters are quite rare, but they can happen when you have a lot of swelling. They can pop up on the surface of the skin. They can be annoying. They can pop up underneath the bandage. And then when the nurse takes the bandage off, she de-roofs the blister, which is not pretty to look at. Now, if you see a blister, should you pop it with an old safety pin you found under the desk from 1972? No, leave it alone. Leave it alone. If you want, we can send a nurse to the house. If you don't want to look at it, you say, oh, I want someone to put a bandage. We will send a nurse out. She will cover it up with a bandage. You don't have to look at it. Just leave it alone. If you have any concerns, we'll tell you what to call and who to call in a second. Right. Preventing infections is obviously important. Washing your hands, staying away from people that are not well. Everyone should do that before any surgery, right? Stay away from those little children's parties. After surgery, when you go to the dentist, there is a protocol. You should have it from the clinic. It should be in your book. Try to stay away from the dentist a few weeks before surgery, right? Up to like 4 to 6 weeks after. If your cleaning is not necessary, just delay it, right? recommend that you do take antibiotics for 2 years after surgery, right? And that's only twice a year. If you go to the dentist for a cleaning, it's 4 pills an hour before you go in for your cleaning. It's really not difficult, right? So if you're going to the dentist in a few months after surgery, call the clinic, tell them you're going to the dentist for your cleaning, and they'll send a script in for your amoxicillin to your pharmacy. If you're allergic, they'll send something else. So just be proactive, right? Additional information. I sent this to everybody, okay, except you, Kathy. Don't worry. These are websites to go to get information. They are, pretty good websites. The middle one, the American Academy of Hip and Knee Surgeons, is an excellent website. Talks about same-day surgery, outpatient surgery. The only thing you shouldn't really do before surgery is watch a video of a knee replacement or a hip replacement. I know some of you have. It's not really good for your mental health. Don't do it. You don't even need to know. Why would you need to know? Just let the surgeon do what the surgeon's best at, okay? There is good videos, exercise videos on that website though, because after COVID, when everything shut down, we were scrambling, trying to figure out how patients were going to do exercises at home because there's no home care. All those patients who did surgery on that week before March 13th, they're all home by themselves. So we had to figure out, okay, we've got to get these people moving, right? All right, so don't go to YouTube, just stay away, right? Go to these websites. Pharmacy Advantage is a free delivery program, and we forward through Pharmacy Advantage. So if you want to sign up for your regular medicines, you can. That is a number, and you can sign up and they'll deliver and then just charge you in my chart. So if you want to do that, that's good. What a hip replacement looks like after surgery. 2 screws, 1 screw, or no screws, depending. This young lady was 21, I think, 22. When she had her first hip, had a second one 4 weeks later, right? That's what it looks like on an x-ray for a hip. Total knee. That's what a total knee looks like on an x-ray. All right, now you'll see the difference between a total knee and a partial knee. It's a pretty big difference, right? Smaller incision, fast recovery, no need for PT, day of surgery. Now listen, everything for the partial knees is exactly the same. You still have 2 weeks of home care, you still go to outpatient physical therapy, you still have all your medicines to take, you still need a walker with 2 wheels on the front. You just don't have to pass any goals the day of surgery, right? Except walk to the bathroom, empty your bladder, okay? All right. Now, what do you do if you want to panic? Some of you will, right? On the day of surgery, you will be provided with this blue wristband, right? This is our joint replacement helpline. This is a number for it. We put it on your wrist and we ask you to keep it on for a couple of weeks because then we know you have the number wherever you are in the house. This is a helpline, not a hotline. There's a difference between a helpline and a hotline. Hotline is where people are just sitting there waiting for you to call. Hello, 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 hello. No, this is a helpline. There are 2 people that answer the calls. They may be on another call when you're calling. What do? Do you keep calling until they answer? You leave a message. Hi, my name is Nikki George. I'm calling for a refill on my oxycodone. Can you send it to Walgreens at 13 in Orchard Lake Road? Thank you. Bye-bye. Or it could be, hi, my name is Nikki George. I have a lot of swelling and there's some bleeding in my bandage. What should I do? Please call me back. They will then contact the nurse. The nurse will call you. If it's just a refill, we just get the surgeon to sign it and then they send a refill. But remember, it can take 24 to 48 hours. So please be aware of that. Should you call the helpline if you have chest pain? Never, right? If it's a medical emergency, you call 911. Never mess around with anything like that. If you're short of breath, if you have chest pain, feel like someone's sitting on your chest, it's 911, okay? But for the helpline, you can call for bandage issues. I can't remember when my appointment is with the PA, the virtual appointment. I lost my AVS. When is the nurse coming out? I forgot. Just call the helpline number, okay? It's generally During the week, we answer the calls and call you back between 7 a.m. and 7 p.m. Now, after hours, what do? You still call this number, but you press 0. And what it does is it sends you to the switchboard here at the hospital. And this is what you say. I had surgery the other day, I had my hip replaced. I just got up to the bathroom and I felt something pop and I can't put any weight on my leg now. I think something might be wrong. So what they'll do is they'll take your information, they will call the surgeon on call, and they're going to call you. That's how it works after hours. So make sure it's real. Okay. And if they don't call you within an hour, call back again, because they may be in an emergency surgery. You know, it could be something, right? And it might not be your surgeon, right? It could be somebody else, but they're going to look you up. They're going to see what you had. And they're going to call you. Stay away from the emergency room. That's basically what we're saying. Why? Germs. Germs. There are people there with infections. We don't want a fresh post-op patient near somebody with an infection unless it's a medical emergency. That's completely different. Most things we can handle at home. We can send the nurse there first thing in the morning. Let's say your bandage is leaking a little bit. We can send the nurse there. Wrap it up. Just get an ace wrap, wrap it up, put some pressure on it. Then when the nurse comes, she can bring a fresh dressing and bandage it up for you. Okay? All right. Patient stories. This is on the henryford.com website. It's a great place to look. Most of them are Henry Ford West Bloomfield patients. Total knees, total hips, partial knees. Stories. Happy stories. People just want to tell you the worst stories, don't they? Oh, my friend Joe, he had a knee replacement, you know. And then, I don't know. I don't know why people want to tell you the worst stories, but these are great stories and you'll have your own great story to share. So please share it with us if you want to, okay? I think I'm going to stop here and let Suzette do her part. And then after Suzette, we're going to pause the video to do questions, okay? So I'll be back shortly. Thank you for your patience.
Hi, everybody. I am Suzette. I'm one of the physical therapists here. So I'm just going to kind of walk you through, first of all, how to set up your home so that when you go home from your surgery, it'll be easier for you. And secondly, walk you through what we do when we see you post-op, because we see you the same day you have surgery before you go home. Okay. So basically, the day of surgery, we'll go over that first. When the nurse thinks you're ready to get up and get moving, they will give us a call and we will come down and see you. And we'll have a one-on-one session with you. And we're going to ask you a lot of questions about your home setup because we want to make sure that when you go home that you're able to navigate your house. Okay. So we definitely want to know all about the stairs and if you have a handrail and if so, what side it's on and how many stairs, all those kind of things. So just kind of take note because sometimes, you know, people ask me that. You just don't remember. You do it all the time and you don't remember how many stairs or what side the rail's on. So take note of those things before coming in for your surgery, okay? Also, we kind of want to know about your bathroom setup. So if you have a walk-in shower or a bathtub that you have to get into, if you have grab rails, if you don't. So the general house setup and also like how you were moving before surgery can give us a lot of information about what we need to do to help you get home. So like if you were using a walker or a cane or a wheelchair or someone had to help you with dressing or bathing, or if you were totally independent and driving and doing everything. So we're going to ask you those types of questions as well. And then we will want to know where you're going for your outpatient surgery. Hopefully you'll know by that time. So we'll ask you, if it's a Henry Ford, we'll circle the number and give you the address and all that. If it's not a Henry Ford, that's not a problem at all. It's just they like to know so that if it's Henry Ford, they can call you if they don't hear from you, basically, okay? And then really when they say pass PT, it's not really scary or anything. We really just want to make sure that you can walk like 50 feet, which is like room to room, using a walker. And that if you have stairs, that you can get up them safely and you can get in and out of bed. You can get in and out of a car. So really basic, okay? And we will go over all your precautions that day. I'm not going to go over them today because it's not the same for all of you, right? It's going to depend on your surgery and your surgeon. So we'll make sure that you understand them, you're integrating it into your movement before you go home, right? I think that's, mostly it for what we do the day of, and then most people do great, and then they go home. If for some reason you're having a really hard time when we come the first time, usually we'll give you another hour or two, and then we'll come back, and then usually people do just fine. Okay, it's very rare people have to like stay over, so that's really nice to be in your own bed same day. That being said, to set up your house, a little bit beforehand, it is 100% fine for you to go upstairs if your bedroom is upstairs. You can do that the same day, okay? If you are doing stairs now, there is absolutely no reason for us to think that you wouldn't be able to do it after surgery, okay? Now, if you're really struggling and can't go up the stairs now, well, that might be different. That might take a little longer. But if you're doing it now, we want you to be able to do it when you go home, okay? We do not want you going up and down all day long. So plan to have a place on the main floor that's comfortable for you, okay? Because most people will go upstairs for bed and then they'll come down during the day and then they'll go back up at night, all right? And if you don't feel comfortable too going on the stairs, or one day you're more painful and you just don't want to do it, having a place to stay on the main floor is really helpful. You don't have to have a bed, a recliner, just not a low chair. Okay, low chairs are going to be rough. You want something that's comfortable that you can get in and out of easily. All right. Some other things for setting up the house would be, so you're going to be using this walker. Right, I'll show you. I have to show it so that people at home can see too. Okay, so it looks like this: 2 wheels in the front, pegs in the back. So not the one with 4 wheels. Okay, those move way too fast. You're going to have pain, you're going to have swelling. You need the stability of this type of walker. And, most people only use it for like 2 weeks. All right, it's not forever, but it gives you the stability to make sure that you have the best outcomes from your surgery. Okay, so don't worry about it. It's just a short time that you'll need it, right? You can get here today. If you're here today and you don't have one, Nikki can help you with that. If you're borrowing one from somebody, that is also fine. Just make sure, they're adjustable, but to an extent. So there are different sizes within the range. So if you're like 5'1" and the person you are using it from is 6 foot tall, it probably won't work, okay? The way you can tell is, I'm going to show this kind of awkwardly here, but this gray piece on the handle, when your arms are at your side, you want the crease of your wrist to fall right there. And now, sorry for everyone at home, but I'm just going to come out here for a second. So here, it would fit me, right? Because my wrist is right here on the gray. So that when I'm walking, I can be by the walker with my shoulders relaxed and my arms a little bent. I don't have to have it out here, and I don't have to be like this. Okay, we want it to be comfortable with your shoulders relaxed. But because you're using the walker, throw rugs can be kind of an issue. They can get caught, you can trip, it's not great. So if you have a lot of throw rugs, you may want to just kind of remove them for a couple of weeks and then they can go back, okay? Another great thing to have is a night light, because if you are going to be on pain medication and things like that, you're getting up in the middle of the night, you want to be able to see what you're doing, okay? Because again, swelling, pain, and pain medications, right? So just be careful about that. Make sure you have a good lighted path that's clear for you. And then the other thing about the walker is if you have very narrow doorways, you might want to think about that too. You need about 29 inches for the walker and your hands to go through the door comfortably. So if that's not going to work for you, kind of think ahead, all right? Sometimes people have to go sideways to get into a bathroom or something, but just set up your house so that you can get around fairly well with the walker, okay? Another question that we get often is about, toilet seats and shower chairs. So if you are able to get up and down okay from your toilet seat, get in and out of the shower now without those extra, devices, you should be just fine. Okay. It's not, that it's bad to have them, but insurance doesn't cover those. They'll help cover the walker. They don't do shower chairs and they don't do elevated toilet seats and those types of things. So you're welcome to get them, but you likely won't need them unless you're really struggling right now and you feel like you'd just be safer. If we see you that day and we're like, it might not be a bad idea, we'll let you know, but we just don't want you to have to buy all this equipment that's just going to like sit in your garage and never be used. Okay. As Nikki said, getting up during the day is so important. It's going to help you with preventing blood clots, with the swelling, with everything. So don't, get stuck in a pattern where you're watching Netflix for 3 hours and not getting up. Okay. Set an alarm. I know, set an alarm and just get up, walk 5-10 minutes, and then go back to your show. Okay. The other thing I wanted to just mention is in your book, which I don't have a copy of right here, but in the joint book that you have, there's some really simple exercises with pictures in them. The home therapist is going to go over those with you, the day after surgery. However, if you're wanting to, you can sort of rehab yourself a little bit. Totally not required, optional. It's simple exercises. They support the muscles that support your hips and knees. Okay. So if you just want to get a little leap on the strengthening part of it, you can do them. If they cause pain or they're confusing, just leave it. You will have someone one-on-one teaching you those. Okay. And I think that's mostly, one other thing people have questions about often is, what to wear on the day of surgery. Comfortable clothes. So comfortable tennis shoes and loose fitting things. If you're having a hip, you're going to want something loose on your waist, right? You don't want something squeezing that you have to button and all that, because you're going to have a little swelling and it might be sensitive. And same with your knee, loose pants, shorts, loose skirts, anything just simple, comfortable, easy to take on and off clothes. And comfortable shoes like flip-flops, and it's kind of getting cold now, but flip-flops really aren't the best. So something with a back on it that's, easy to walk in. Okay. And that is it. Okay. All right. All right.